Hello friends, if you have already done your hair transplant and you are not happy with the shape of your hairline or the density or the angles of your hair, don't lose hope. Please watch this video till end, you will find the solution. I am your friend Dr. Shail. Our aim of making these videos is to tell you the truth. Now, this is a case of one of my patients who had done an FUT surgery earlier somewhere else. If you take a look at the shape of his hairline, that's awful. It really looks very unnatural. The angles, the shape, everything is wrong here. It couldn't have been worse. Patient had a big scar at the back of his head on the donor side, and he was really very upset and not happy with the results. Patient is a highly qualified and educated person. Probably he fell prey to discount offers, cheap transplant offers, and maybe didn't pay enough attention to the quality of work. So whenever somebody is planning to go for a transplant, sometimes we think we used to have hair in like this. Let me fill it the way I used to look earlier in my teens. A very important point here which I would like to highlight is females and males before puberty have kind of similar hairline. Then there is bitemporal recession, which is seen in almost more than 90% of males. Now if we give this kind of hairline like this, it gives a feminine look and it doesn't look good on a male face. If you see this image, we created this kind of hairline. This was a transgender patient, so for her it was good, but it is not going to look good in a male patient. And then the angles of hair also matter. If you see the angles of hair in this patient are really bad. So in such patients, the challenge is we have big scars in the donor area, as well as there is a lot of scarring in the recipient area as well. Now to extract these hair and reuse them is a big challenge. It is not as simple as you are extracting hair from the donor side. Because of the scarring, because of the varied angles, becomes really tough and requires a lot of expertise to take them out. Even with years of experience, sometimes it is not possible to take them out all. So part 1 we did extraction, where we took grafts from these areas. We did an FUT surgery by including the scar of previous surgery into second. The wrongly placed extracted grafts were reused, temples were created. Now at the same time, when you are trying to extract and create hairline, it becomes difficult and sometimes it is not possible to give the finishing touch. So we had planned another surgery maybe around 8-9 months later on, and if you can see the results of first surgery, initially there is scarring because of extraction of these grafts because they were placed too close. So the scarring gradually fades out, and then we did an FUE surgery. We did some FUE grafts in the scar of FUT as well. We created the hairline, we filled the temples, we filled the crown this time also. The 15 days post-op picture now shows a good coverage, a decent hairline, and the remaining grafts which were left over, we had extracted this time all of them. We'll keep updating you regarding the progress in this case, and we really hope of delivering him best results. So it is my urge, please pay attention to the artistic aspects of hair transplant. It is not just about filling your head with hair. It is about the way you do it. So if you haven't done your transplant surgery and you are planning to get it done, do think about this. And if you have already done your transplant surgery and if you are not happy with the shape, there is still hope. It can be repaired. So if you like the video, please press the like button. You can also subscribe the channel for more information. Thank you. Love yourself. Stay blessed.